Breathing. It's usually smooth and easy. We run, play, go about our daily lives, and hardly even notice it. But if a child suddenly has trouble breathing, it's an emergency.
Hang on, something's wrong. Antonio! Antonio! Come off the field! Come here! What's wrong? Is it your asthma? Yeah? Where's your inhaler?
Asthma is common in children. During an asthma attack, a child may have trouble breathing, coughing, tightness in the chest, wheezing, or a whistling sound, fast breathing, or show other signs of breathing problems. Some children take daily asthma medication, while others only take medicine when they have symptoms.
Okay, come here. Come here. Is this the right medicine? Okay.
Many children with asthma know about their medical condition and carry inhaler medicine. It can help them breathe easier within minutes of using it. However, at times a child may panic when he has trouble breathing, and younger children may not be able to use their inhalers at all. You may need to assemble the inhaler and help them use it. If a child in your care has an inhaler, make a first aid action plan with the parent or guardian for how and when to use this medication. Inhalers are made up of two parts, a medicine canister and a mouthpiece. Some children also use a spacer that makes it easier for the child to inhale all the medicine. To assemble and use an inhaler, first shake the medicine. Put the medicine canister into the mouthpiece. Remove the cap from the mouthpiece. Attach a spacer if there is one available and if you know how. Tilt the child's head back slightly and have him breathe out slowly. Put the inhaler or spacer in the child's mouth. Push down on the top of the medicine canister. Have the child breathe in slowly and deeply as you push down. Then, have the child hold his breath for about 10 seconds and then breathe out slowly. Also, it's important to know that there are different kinds of inhaler devices. Assembling a child's inhaler is just one step in the first aid actions for a child with asthma. Here are the steps all together. First, make sure the scene is safe for you and the child. Get the first aid kit and wear personal protective equipment. Keep calm and try to soothe the child. Crying can make an asthma attack worse. If the child has prescribed medication for asthma, get it. If this is an inhaler, make sure to get all the parts and help the child assemble and use it. Follow the correct dosage listed on the medication. Phone 911 if the child has no medicine, the child does not get better after using his medicine, the child's breathing gets worse, the child has trouble speaking, or the child becomes unresponsive. Provide CPR if the child becomes unresponsive and stops breathing or is only gasping. Stay with the child until someone with more advanced training arrives and takes over.
Your soccer team's doing great this year. You still enjoying it?
I like it and all, but I'm not as good as some of the other kids.
It takes practice just like anything else. Your mom and I were thinking about sending you to a soccer. Are you choking? I'll help you.
Choking is a common emergency with children because food or some other object can become stuck in the airway. Some choking is mild and some is severe. If a child can make sounds or cough loudly, then the block in his airway is most likely mild. Stand by and let him cough, but if you become worried about his breathing, phone 911. The choking is severe if the child cannot breathe, has a cough that has no sound, cannot talk or make a sound, or makes the choking sign. When a child has severe choking, give thrusts slightly above the belly button. If the child is smaller, you may have to kneel to get into correct position. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. When a child's choking is severe, act quickly by doing the following. Are you choking? I'm going to help you. Stand or kneel behind the child and place your arms around the child's waist. With one hand, locate the belly button. Then make a fist with the other hand and place the thumb side of your fist against the child's abdomen, just above the belly button and below the breastbone. Grasp your fist with your other hand and press your fist into the child's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object comes out and the child can speak, cough, or breathe, or becomes unresponsive. If the child is too large for you to wrap your arms around the waist and his choking is severe, put your arms under the child's armpits and your hands on the center of the child's chest. Pull straight back to give thrusts on the chest instead of the abdomen. A child who has been given thrusts should see a healthcare provider as soon as possible. If you give a child thrusts but cannot remove the object blocking the airway, the child will become unresponsive. Watch to see how this might happen and what you should do.
Help me lower him to the ground. Phone 911 and get an AED.
When a child with severe choking becomes unresponsive, lower the child to a firm, flat surface. Shout for help. Phone or have someone else phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, leave to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the child starts to respond or until someone with advanced training arrives and takes over. Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto his back, supporting his head. Give up to 5 chest thrusts, using 2 fingers of your other hand to push on the chest in the same place you pushed during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up on a firm, flat surface, and then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out, the infant starts to respond, or someone with advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. Dehydration occurs when infants or children lose water or fluids through heat exposure, too much exercise, vomiting, diarrhea, fever, or decreased fluid intake. If not responded to early, dehydration may lead to shock, which can be fatal. The best first aid for dehydration is prevention. Make sure a child drinks and eats enough to stay hydrated. Signs of dehydration include weakness, thirst, dry mouth, dizziness, confusion, less urination than usual, and less hunger than usual. If you suspect a child is dehydrated, contact a healthcare provider right away.
Okay, class, let's line up and head to the library. Camille,
No, I don't want to play.
we're going to the library, Camille, not the playground. You love the library. Are you feeling okay?
Diabetes is a disease that affects the levels of sugar in the blood. Too much or too little sugar causes problems. Some children with diabetes take medications such as insulin to maintain their sugar levels. But if a child with diabetes experiences low blood sugar, her behavior can change.
Camille, did you eat your lunch today? You may be hungry if you didn't eat lunch.
No, I forgot it.
Ramon, can you get Camille some orange juice from the lunchroom? Thank you.
Low blood sugar can occur if a child with diabetes has not eaten or is vomiting, has not eaten enough food for his or her level of activity, or has injected too much insulin. If low blood sugar occurs in a child with diabetes, the child may become irritable or confused, hungry, thirsty or weak, sleepy or sweaty, or the child might even have a seizure.
Thank you, Ramon. Here, Camille, can you drink this? This is Betty March in second grade 2B. Camille Stewart hasn't had lunch and she's acting confused. I know she has a first aid action plan for her diabetes. She's just had some juice. Is there something else I need to do? Oh, okay, good. And would you call her parents? And can you please send the school nurse to my classroom? Camille, can you walk with me to the door? We're going to meet the nurse.
Signs of low blood sugar can come on quickly in a child with diabetes. Take the following first aid actions. If the child can sit up and swallow, ask her to eat or drink something with sugar that can rapidly restore blood glucose levels. These items include glucose tablets, orange juice, candy such as jelly beans. If the child can't sit up or swallow, don't force her. Have the child sit quietly or lie down. If the child does not improve within 15 minutes, phone or have someone phone 911. To treat a diabetic emergency, it's important for parents and guardians to share a child's first aid action plan for diabetes or any other condition with the school or child care center. Diabetic children often have emergency supplies with them. Keep these close at hand. Follow any prescribed diet or directions for insulin use that a doctor has provided and that is outlined on the child's first aid action plan while the child is in your care.